This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, February 17th, a month before St. Patrick's Day, we are joined by Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a live broadcast sponsored by Spectrum Health-Zeeland Community Hospital. Really delighted this morning to have Alison Clark, the communications specialist and the public information officer from the Ottawa County Department of Public Health, on this morning to provide some updates. Good morning, Alison.
Good morning, Sara. Thanks for having me.
And this is a first for you because you are new in your role. So tell us about what you do.
Yeah, I've been here for just a few days, past 4 months, so I'm still relatively new and getting to know everything that we do here at the Ottawa County Department of Public Health. But my role is really to communicate with the community everything that we have to offer to them, make sure that they have access to the services that we're providing and the information that they need in order to access it. And then, of course, if we have an emergency, I put on that public information officer hat and move into that role.
So what do you enjoy about your work?
Well, I have always really admired public health long before working in this field and with the department. I think public health just does so many things for the community that often happen in the background that people don't even really know about. But if those services went away, the community would really be adversely affected. So that's one thing, but also the staff here is just really incredible. They really care deeply about the health of our community. So it's been a real treat to get to know all of them and start to just learn about all the services we offer.
So while we remain cautious, our optimism is increasing regarding COVID-19. And isn't that wonderful to be able to say? Yes. So give us an update on what is the status of COVID in Ottawa County.
Yeah, so like many places throughout the state and the country, our case rates and our test positivity here in Ottawa County is decreasing as well. So as you said, we feel really great about that. We want to not only share warnings and things like that with the community, but we also want to share when we have good news. And so right now we definitely are feeling hopeful about the reductions that we're seeing and just remain optimistic for what that means in the coming weeks. We've had decreases for about 3 weeks now, so we're hopeful about what that means.
So, in the light of those decreases, what are some ongoing activities at the Ottawa County Department of Public Health in light of those decreasing case counts and test positivity?
Yeah, even though things are really improving surrounding COVID-19, it's still here. It hasn't gone away. And so we're not reducing any of our activities at this point. We are still providing vaccination clinics regularly throughout the county. We have clinics scheduled in the month of February. We'll have more vaccination clinics available in the months to come. Testing is still widely available in the community, and it's still really an important tool that we have as we try to continue to get past the emergent phase of COVID-19. So we're encouraging people, if they feel that they need a test, to still access those. Those are available Monday, Tuesday, Thursday, and Saturdays in the county. Last week, we distributed about 100,000 KN95 masks throughout the county to all of our cities, townships, and villages. And then they are at some local libraries as well. So anyone who's needing a well-fitting KN95 adult mask can go access those at those locations. And then, of course, we're continuing to monitor and evaluate metrics and really make all of our policy decisions based around what's happening in our region and in the county.
Well, and I just want to say thank you for those masks. I'm a block from the local library, and so I picked up mine. And
great,
right, it's a much more secure fitting mask.
Yeah,
and just makes you feel good about going in the community. So thank you.
Yeah, the KN95 masks are really more protective. And, as we've continued to learn more about COVID-19, as you know, being at Spectrum, guidance has had to change, but what we now know that those masks provide the best protection. And so if you don't have those, we're encouraging the community members to go find those at their city, township, or village office.
So my guest this morning is Alison Clark, Communications Specialist and Public Information Officer from the Ottawa County Department of Public Health. She is joining us via Zoom. So if you have a question, you can call Gary at 616-395-1450. That's 616-395-1450. And he will share that question via our chat. It's amazing what we can do, isn't it, through technology? What we've done in the last couple years with this COVID. Okay, so we've talked about COVID, but we're also in flu season. So we got the double whammy of COVID, and then we have flu. Just talk a little bit about that and the vaccine. If someone has not had the vaccine, should they still consider getting one?
Yeah, so flu activity really starts in October in Michigan, tends to peak in February, but really can go throughout the month of May. So we're still well in the flu season here. For some people, flu will have some more serious outcomes, especially for the elderly or young children, people who are immunocompromised. And so if you haven't received your flu vaccination yet, we would encourage you to still access that. You can do that at many local pharmacies, doctor's offices. We do provide those for some populations here at the county as well. But that will really provide, it might not cause you not to get the flu, but it will hopefully protect you from any severe outcomes or severe illness that you might have as a result of getting the flu. And flu activity here is lower than it was last year at this time, because a lot of the COVID-19 mitigation strategies that were in place protected us from the flu as well. But it is a little bit higher than it was last year. So we still are below where we were pre-pandemic. So that's good, but it's never a bad thing to get a vaccination and protect yourself just in case.
Yeah, I would just, attest to that. Several years ago, before COVID, I had my flu shot, and I did get the flu, and it was a much more minor case than, if I wouldn't have had the flu vaccine. And I was very, very thankful for that. So, I'm just an advocate to get that vaccine.
Yeah,
okay.
Definitely.
So, for the past couple years, the focus for the Ottawa County Department of Public Health has been on COVID. But still, there are many, many different community health services that you offer. And I think you shared that at the beginning when you said about what you appreciate about your job is, we have all of these services that the health department provides. And if we weren't here, people would notice it. So want to switch the focus a little bit and allow you to talk about some of those. So one of them is the Vaccine Equity Advisory Council. Talk a little bit about that. And that's something that I have never heard about. So I'm really interested to see what you're going to share.
Yeah, well, thank you. So, public health has been kind of catapulted onto this really visible stage, although we've been around for over 80 years here in Ottawa County, providing lots of different services. If you go to a restaurant, we make sure that restaurant is providing a safe environment and safe food practices so that you don't get a foodborne illness. We try to protect drinking water and help moms who are going through pregnancy and learning how to care for an infant. So we do a broad spectrum of things. Our mission is to assure conditions that promote and protect health. And so we have a lot of services that fall underneath that. One of those is a new thing, as you mentioned, our Vaccine Advisory Council. And what that is we were awarded a grant from the Community Foundation of Holland and Zealand to address vaccine disparities, both for COVID-19 and for other adult vaccinations for the Hispanic and Latinx community. And one of the activities related to that grant award is that we are compiling a vaccine advisory council who will consult with us about how we can speak to those communities and try to close those gaps between Hispanic and Latinx communities and non-Hispanic and Latinx communities. So sort of one of the first activities we're doing is trying to recruit people for our vaccine advisory council. And what we're hoping to do is recruit people who either are in the Latinx and Hispanic community themselves, who live in Ottawa County, or those who work with those groups of people or have a desire to work on increasing vaccination among those populations. The Vaccine Advisory Council will meet bi-weekly to start and consult with us on ways that we can increase vaccination among those groups of people. And our eventual hope is that we'll develop an outreach campaign that will reach those groups and increase vaccination rates. Again, like I said, COVID-19 and other vaccinations. The grant does provide a little bit of compensation to that advisory council. So anybody who's interested can contact our community health manager. Her name is Sandra Lake, and her email address is slake@miottawa.org, and she can provide all the specifics about what we're looking for and when things will get going.
Are those meetings going to be in person, or, if someone is concerned about the, COVID out there, will they be via Zoom, or how will that work moving forward?
I think, our community, even though COVID, as we talked about, is improving, we're still in the high transmission phase. And so we want to be aware of that. So to start, those meetings will happen virtually. And then hopefully things will continue to improve in the county and we can do those in person at some point.
Well, it's really exciting to get a grant like that, and that the Community Foundation of the Health-Zeeland area sees a real need to support that. So again, if someone is listening and they would like to be considered for that, they would email, is that right, Sandra Lake?
Yeah, email Sandra Lake, and again, her email address is slake@miottawa.org. I should have stated that our nominations for the advisory council or applications will be open through February 25.
Okay, thank you very much. You're also participating in the Share the Love, Share Some Products initiative. Tell us about that.
Yeah, so this is not actually a program of the health department, but we like to be connected and connect the community to programs that assure health. And one of those is the Share the Love, Share the Product campaign. And that has to do with the elimination of the tax on feminine hygiene products that just went into effect on February 3rd. So the Share the Love, Share the Product campaign was supposed to be a campaign where people could donate feminine hygiene products to the menstrually insecure in our community. It was supposed to just happen on Valentine's Day on February 14th, but actually we are extending our drive throughout the month of February. And so anyone who's interested in donating products can come to our location in Holland on James Street, 12251 James Street. We've got a collection bin out in our lobby, and those will be distributed to women in our community who need those products.
So, Alison, time flies. We only have a minute left. Any last thoughts that you would like to leave with us?
I would just say, again, just going back to COVID, we want our community to feel good about where we are and feel encouraged about that, but we also don't want anyone to let their guard down. We're not out of the woods yet. So I would say continue to use those tools that we have, vaccination if you haven't already done that, or booster shot, wearing your mask where you feel you need to do that, and getting tested if you need it as well, if you think you've been exposed.
So thanks for being here, Alison. I look forward to having you on again in your new role at the Ottawa County Health Department. Until next week, Spectrum Health-Zeeland Community Hospital wishes you well.